Hello guys, in this video we'll be talking about the Neonatal Resuscitation Protocol. Also guys, in this video I have included a mannequin video of a child where we have demonstrated the protocol. Okay guys, so that will help you apply whatever you have read in the protocol. So let's get started guys. Okay, so if you see the photo guys, okay, so basically in the picture you can see a mask is being applied on the baby guys, okay, on the mannequin guys, and this basically is the neonatal warmer guys, okay, on which the baby is kept post delivery guys. Why? Because they need adequate temperature guys. What is the normal temperature of the newborn guys? If you can recall guys, it's 36.5 to 37.5 degree guys, okay, if you can recall. And this is the video mannequin demonstration that I'll play after we are done with the theory. Okay guys, see, we'll start with the protocol guys. Okay, so this is the updated protocol guys, okay, that is Neonatology Resuscitation Protocol 8th edition guys. Okay, so basically what we do, basically it starts before the birth of the baby. So what happens guys, कि doctor the obstetrician will call the pediatrician, कि we are when will they call the pediatrician guys? When the crowning is seen guys. So they call the pediatrician saying that baby is course in due course of time, so please come soon. So basically what are the steps before that? Is antenatal counseling, briefing your team guys, your pediatrician, and equipment check. So what are the things pediatrician need to check guys? Whether the neonatal warmer is on or not guys. This is very important because adequate temperature, we need to keep the baby warm. Whether all the equipments like laryngoscope guys, suction tube are present or not present guys. So after they are done with these things, baby is born after some time, birth of the baby child. Okay, so when the birth baby is born guys, we check for three things guys, that is TTC, that is term, tone, and cry guys. Term means whether the baby is term baby or a preterm baby. Do you recall guys, how do we check between term and preterm? We have a score that is known as guys new expanded Ballard score, which is used to check term or a preterm. Then tone of the baby and crying of the baby, that is TTC guys, recall. Okay, so see, if everything is fine guys, what we will do, we will go for routine newborn care, like we will go for delayed cord clamping guys. Then we will warm the baby guys. Then guys we will suction if anything is there guys. Suction is not compulsory guys. Okay, so these are the things in routine care. Now see, if everything is not fine guys, okay, so we'll suction and other things. So now we'll check guys for the heart rate. Okay, so we'll see if the baby is apneic, gasping for breath, or if the heart rate is less than 100 guys. Okay, so if heart rate is less than 100 guys, we'll go for positive pressure ventilation. That is guys, we go for bag and mask ventilation guys. Okay, so see, you might have remembered that there is one absolute contraindication for bag and mask ventilation. Can you recall guys absolute contraindication for bag and mask? That is congenital diaphragmatic hernia. And what is the most common type of congenital diaphragmatic hernia? That is posterolateral variety of guys, Boca-Deloc type. Okay, so this is important from NEET PG aspect guys. Okay, so see, what we are doing, we are giving positive bag and mask ventilation, and we connect two monitor, that is cardiac monitor and pulse oximeter guys. Okay, so basically a question arises, how do you check for heart rate? Everyone say we check for heart rate. So here we use either a stent guys, or we can check for umbilical cord pulsation. So how do you count by the umbilical cord pulsation? We know when you clamp the umbilical cord, what happens guys, normally there is two artery and one vein guys. Okay, this is the most common type is seen guys. Okay, so what happens guys, this veins have a collapsed lumen guys. Okay, so this umbilical cord pulsation can be checked here guys, and what we do, we check it for 6 seconds guys, and we see the pulsation and we multiply it by 10, so that 60 seconds 1 minute is done guys. Okay, now see, suppose it was less than 100, you did that. Suppose it was not less than 100 guys, but the baby shows labored breathing or cyanosis. So basically we need to give more oxygen. So oxygen therapy, we'll connect pulse oximeter and we will consider CPAP. So what is CPAP guys? Continuous positive airway pressure guys. Okay, see, now even after doing these measures guys, heart rate is still less than 100. What we will do guys, we will ensure adequate ventilation, that ventilation is fine or not fine guys. Okay, we'll consider endotracheal tube or a laryngeal mask airway guys. Okay, and we will monitor the cardiac output. Thick. So now if everything goes fine guys, we'll go for post resuscitation care guys. Okay, now if even after doing this heart rate falls further, that is less than 60 guys, so here comes the importance of chest compression. So chest compression is done usually after intubation guys. Okay, if you are adequate enough to do intubation, please go ahead with the intubation guys. Okay, and will coordinate with 100% oxygen. And what is UVC? That is umbilical venous catheterization. Why do you need to catheterize, guy? Because if it is not responding, guys, you need to give adrenaline. So this adrenaline, guys, epinephrine, okay, for that we need to have a UVC catheterization. If it is not possible, guys, in such cases what do? We give by intratracheal route, guys. Okay, so this is important, guys, intratracheal route. See, now even after these things, heart rate still remains less than 60. It means that there is some hypovolemia or pneumothorax. So we can try with IV fluids, guys. Okay. So see, this is the target oxygen saturation that we need to know for 1 minute and 10 minutes at least, guys. Okay. 1 minute, 5 minutes, 10 minutes. See, if you see 1 minute, guys, it's 60 to 65%. If it is less than that, you need to interfere, guys. Then further increase 60 to 65, 2 minutes 65 to 70, 3 minutes 70 to 75, 4 minutes 75 to 80, guys, 5 minutes 80 to 85, and remember for 10 minutes it's 85 to 95. We have a gap of 10, guys, in 10 minutes. Okay, so what is the oxygen delivery concentration that you will give for positive pressure ventilation, guys? If the baby is more than 35, means approx a term baby, guys, then we give oxygen at room temperature. What is the normal concentration of oxygen in air, guys? That is 21% oxygen. So when we give with the help of ambo bag, guys, here we do not need a reservoir and we do not need to connect to oxygen tubing, guys. Okay, so this is important. If it is a preterm baby, we need to give 21 to 30% of oxygen, guys. Okay. So this was about the neonatal resuscitation protocol. See, now guys, let's revise. First of all, we have briefed counsel and equipment check. Labor room ka temperature. What is the normal labor room temperature, guys? That's 25 to 28 degrees Celsius. Pediatrician has switched on the warmer and suction tube and other equipments are ready. We'll assess TTC, that is term, tone and cry, guys. And if everything is fine, go for routine newborn care like warm, airway suction if needed, and dry the baby, guys. If it is not there, we'll stimulate the baby. So how do you stimulate the baby, guys? Okay, we stimulate the baby with the back of our hand, guys. Okay, please, we do not tickle the baby, guys. This all things are not followed. Like tickling the baby and this all things are not followed now. Now see, we have three possible scenario. Heart rate less than 60, heart rate less than 100, heart rate more than 100. But actually here you have gasping for breath, guys. Okay. See, if the heart rate is less than 60, guys, we follow chest compression, guys. That is in the ratio of 3:1, guys. Okay. So when you do chest compression, guys, you have two methods, guys. Okay. That is thumb method and two finger technique, guys. Okay, so both of the method I'll be demonstrating in the video further, guys. Okay, and further you give along with it bag and mask ventilation. So what is the ratio of chest compression to bag and mask ventilation, guys? That is 3:1. So if you give 3 chest compression, guys, you need to give one breath by mask. Okay, and further if it's not responding, guys, NR, so we give adrenaline. Do you remember adrenaline? What does it? It acts on all receptors, alpha 1, alpha 2, beta 1, beta 2. And it's given in the dose of 1:10,000, guys. But this adrenaline ampule, guys, it comes in the 1:1000, guys. So what we do? We take 1 ml of adrenaline in 9 ml of normal saline, guys. And what is the dose? That is 0.1 to 0.3. And it's given IV, that is through the umbilical venous route, guys. Okay, if not possible, then we will go for endotracheal route. As soon as you answer, guys, endotracheal route, the next question comes to you. What are the other drugs that you give by endotracheal route? So what are that? Remember the mnemonic: nasal, N for naloxone, A for atropine, S for surfactant, A for adrenaline, which we read now, and L for lignocaine, guys. Okay, so these are the other drugs that you give by the endotracheal route, guys. Okay. See, this is a picture. So basically what is this, guys? This is the ambo bag, guys. Okay, and how do you hold the ambo bag, guys? There is a technique known as the C technique, guys, and it is known as the E technique. Do you see, guys? So basically with the C technique you hold the mask, guys, okay, on the face, and with the E technique, guys, you lift the chin up, guys. Okay, and I said about the two techniques, guys. Okay, so basically this is a technique which is known as the chest compression technique, guys. Okay, I said about the thumb technique and the two finger technique, guys. So basically this is the thumb technique. So this technique is better, guys. Why? Because entire chest is in your hand, guys. Okay, and when you compress it, guys, it should go 1/3 of the anterior posterior diameter of the chest, guys. Okay, so this is important, guys, when you try to compress it, guys. Okay, see, we have read this all things, guys, but see, if there is not effective ventilation, guys, remember the mnemonic MR SOPA, guys. Okay, so what is MR SOPA? M is for adjust the mask, guys. R is for repositioning the airway by giving a sniffing position. Sniffing position means basically keeping a shoulder roll under your shoulder blade, guys. S is suction. So how do you suction? Always remember, guys, suction first mouth, then followed by nose. So how do you remember? L, M, N in alphabetical order. Never suction the trachea, guys. This is very important MCQ, guys. Okay. Then O is for open the mouth, guys. Okay, and keep the jaw forward. P is for increase the pressure, guys. The maximum pressure that can be given is 40 centimeter of water, guys. This is important from the MCQ aspect, guys. Okay. Then A is considered alternative airway like endotracheal intubation or laryngeal mask airway. Okay. So endotracheal intubation, guys, this is basically a laryngeal mask airway which is demonstrated. And this one that is demonstrated, guys, this is the endotracheal intubation. In this video, guys, I have also demonstrated the phenomenon of endotracheal intubation, guys. Come, let's get started, guys. Okay. See this video, guys. What is happening, guys? So basically this is the technique of holding the mask. Do you see, guys? What we are doing, using a C technique, guys, and the E technique, guys. Do you see? C technique and E technique is used to hold the mask, guys. Okay. Now see further the next video, guys, what happens, guys. Okay. See in this video, guys, what happens. See what we are doing, we are giving the chest compression. Do you see, guys? 3 chest compressions we are giving, guys. Okay. And you give a breath, guys. Okay. So this was the chest compression. This is the other technique, that is 2-finger technique, guys, which was demonstrated in the video, guys. Okay. This is the neonatal resuscitation protocol which we have already dealt, guys. Okay. See, this is basically the technique of holding the mask, guys. You can see C technique and the E technique wala, guys. Okay. Now see, guys, this is basically how do you insert the endotracheal tube. See. Sorry, guys. See.
But I use the left.
We use the left hand, guys. Okay, we hold the left from the left hand, guys, and we insert it through the right and take it towards the left, guys.
Enter with the right ka angle
and go towards the left, guys.
Deep enough,
and try to visualize, guys.
Tongue.
Okay.
So we see it through this.
Epiglottis should be visualized first.
Some people will require pressure. That time you will ask someone to put trigger because you are with gloves. Then you will introduce the
ET tube. Okay, guys. So basically the blade that we use here, guys, is the Miller's blade, that is a straight line. This has been discussed in my anesthesia video, guys. Okay. Now see, here what happens when you see, do you see the chest rising, guys? See in this video, see carefully, guys, the chest is rising. If you have a look, guys, see this endotracheal tube is connected with the ambu bag, guys, and you can see the chest rising, guys. Okay. So this means that you have done effectively it has been put in the place, guys. Okay. So this is important, guys. Okay, that tube has been placed effectively, guys. So I think hope this helps you revise the topic of it, or topic of neonatal resuscitation. If you like it, guys, please do like, comment, share and subscribe to the channel.